Marcia Foreman. I live on Sherwood Road. I have some questions. The first one may eliminate everything else. Are you still planning to reorganize or get rid of the Board of Health?
That's not on the agenda tonight. We'll have that discussion when it's scheduled for final adoption. At this point, that's not an item for discussion at this meeting. So
now, are you limiting these questions to the items that you just had on the agenda? When are you opening the meeting? I was under the impression that we could ask anything at this point.
You certainly can ask questions, but the answer is the discussion on that is scheduled for June 26th. So it's scheduled, it was at our last meeting, it was voted on that it would be introduced and scheduled for a hearing at June 26th. So that's when the appropriate time for that discussion is.
But I can still ask you questions on it?
Yes, absolutely.
Okay. I'm curious, why are you reorganizing the Board of Health? Is there something wrong with it, or do you think you can improve it? In what way are you improving it?
Okay, like I said, at that point, it's just an introduction. We can certainly, between now and then, depending on discussion that occurs with the Board of Health, depending on discussion that goes on with our health department, depending on discussion that goes on with the State Boards of Health Association, those may change. So at this point, it's probably not best for me to comment on that.
I thought this was an open comment period.
Yes, feel free to make any comments you wish.
Have you met with the Board of Health?
Yes.
How many times?
Met with them, in the span of what time frame? This year, I met with a subcommittee of them at our last meeting. Committeeman Anlin and I met with them. I'd also gone to one of their meetings in December before the reorganization of our township committee and before they reorganized. I was at that meeting with Deputy Mayor Fernandez as well. And that's also why we have a committee liaison as well, because there are multiple meetings that go on at those times, and we all share responsibilities to attend those various meetings. So I have attended, and we have a liaison that's his purpose, that's his function. So
now, how much discussion have you had among you members of the township committee? Because this is a major department in Springfield. It's been here for many years, and theoretically, at least, under state law, it is supposed to be relatively independent of the township committee. And I haven't been on the committee for something like 20 years now. However, we always made an attempt to keep a distance away from the workings of the Board of Health, because of all departments, zoning and health create the most unpleasant feelings when people feel that they have been put upon, they have to pay fines, they have to observe regulations. And the first impulse is, I'm going to talk to the mayor, or I'm going to talk to the township committee. Individuals whom I know well. I've been through that. We have all been through it. And as a matter of fact, at the time I was on the township committee, we made certain that no one on the township committee had a vote on the Board of Health. In order to keep it at arm's length, you don't want to be perceived as playing favorites or favoring one person over another. The Board of Health has always been independent. What puzzles me is the reasoning behind it. Is it financial? Is it that you want more complete control of it? And if you want more complete control, what's wrong with the way they're functioning at this point? This hasn't been brought out in the public. I hope that you will have more meetings with them and Have all 5 of you had a chance to discuss it at any time?
We have discussed this at our last meeting briefly when it was introduced, and as I stated, the liaison and I have spoken about it, and I also know that other members of the governing body have attended their meetings. So I think that there has been plenty of discussion, or at least investigation, by the members of the governing body. Otherwise, we haven't done our jobs in introducing it. And as I said, when it comes time for adoption, each member is free to vote however they please, based on their convictions of whether they've done their job and looked into it well enough to take a vote. So, thank you for your comments, and anything else.
You say you have discussed it. You no longer have executive session.
We discuss everything here because executive...
Everything here have the details been discussed in public? Have you discussed why you want to make these changes?
Yes, the statement was made, at least I made a statement as far as its introduction, at the time of its introduction.
There has been no detailed discussion of what you want to...
I'm not sure what details you're looking for.
You now have, what, a 7-member Board of Health? You're going to reduce it to something like 5?
No, that's not correct. Well, I'll make a copy of the ordinance available to you, and then happy to explain that all in full.
Yes, I would like to see it in full. And have you looked into the cost of it, the financial aspect?
Well, I think you're confused between the Board of Health and the Health Department. The Health Department, as you correctly stated, is one entity. It's very different from the Board of Health.
I realize that.
Right. So
the Health Department is run through Westfield.
Correct.
Right. But you are... Well, I'd like to see the ordinance.
Yes,
because
happy to
I don't
provide
think
you
it
with
has
comments.
been clearly put forth so that the public can really understand it.
Okay.
It's not always easy to know what you people are thinking or doing when you are talking across each other in front and you don't have necessarily meetings in between.
Well, those meetings that happened in between were also in the past maybe 15, 20 years, and at least for the early part of my first term, not very productive or beneficial for the public, because those meetings were held in a small room on another day.
It's not
this is probably more...
what you're discussing here, because it doesn't come across clearly.
Okay.
Maybe you need a new
audio system.
System, but aside from that, sometimes the 5 of you talk to each other. You don't use the mics. You don't look at the audience. And it would be nice if we always knew what you were doing, but I would appreciate seeing a copy of the ordinance.
Absolutely.
Okay.
Thank you very much.